Before we get into using multiple planes of movement inside of aerobic or metabolic work, I think it's really important that we lay some groundwork and actually explain what the 3 planes of movements are and why we need to train them. So I'm going to pass it over to our resident expert, Dr. Ulm, to take us through what the 3 planes of movement are.
Cool. Well, there's 3 planes. So we know that we've got the sagittal plane, which is the one where we spend most of our time in strength training. So that's going to be like your RDLs, your cleans, your swings, wall balls. Most of the time when we're prescribing exercises in weightlifting, it's going to be sagittal plane stuff. And so that's going to be kind of anything in here. So that's your flexion and extension for the most part. The next one's going to be frontal plane stuff, and that's going to be sort of your lateral bending. We get a little bit of this, but it's kind of hard to do like in strength training. There's not a lot of it. If you're doing a unilateral carry, even though there's not a lot of movement there, there's still coronal plane forces sort of bending you one way, so you have to use your muscles to bend the other way. And then the last one that's probably the most challenging is going to be the transverse plane, and that's going to be more of your rotation stuff. So with every movement that we do, you actually have pieces of each one of them. There's almost no movement that is purely sagittal plane or purely coronal plane or purely transverse plane, but we have a lot of these exercises that are sort of biased to one or the other one. Now, one of the things we have to be careful with is because we spend so much time in the sagittal plane, having a day like this where you're exposing the human or the client to multiple planes of motion is really, really important because A, you're not going to perpetuate this overactivity of the sagittal plane muscles, and B, a high functioning human should be able to sort of move and control really all of their joints in all 3 planes. And if we're over programming for just the sagittal plane, what ends up happening is you get dysfunction in the other ones, and then that can cause all kinds of problems with their movement quality and potentially injuries later on.
And just so we're super clear, the coronal plane is the frontal plane, right?
Sorry.
No, totally fine, because I think that coaches are going to run into that where they hear those 2 words thrown around.
Yeah, coronal and frontal are the same exact thing.
Perfect.
And then especially in a mixed setting, you walk through that exercise selection, and that's usually what a coach would program in this setting. So that's where the idea came from, where it's like, how do we explore these different planes in this mixed aerobic setting? Where do cyclical implements usually fit inside of this conversation?
Most of the movements that we're going to see, in that cyclical progression is going to be things that are kind of in the sagittal plane. So the best example is going to be rowing. That is like pure sort of hip hinging, sort of squatting on a rower. Running is also a lot of sagittal plane. Even though microscopically, if you look at all the joints, there's actually movement in the coronal plane, the frontal plane and the transverse plane, but most of the movement in those are going to happen in the sagittal plane. The one that I like the most is going to be the assault bike because that one is predominantly sagittal plane in the lower body, but in the upper body you actually have a pretty good amount of rotation, and so that's going to be transverse plane motion, which is really, really nice. But for the most part, I'm just kind of thinking of the cyclical stuff that we're doing, even like double unders, which I know isn't a cyclical movement, but we kind of use them for the same reason to sort of, I call it a heart rate accelerator, to get the heart rate up a little bit so that you can then be using those in the strength training. They're all kind of sagittal plane for the most part.
Got it.
So now we've discussed what the planes of movement are and why they're important. We're going to move on next to discuss who this kind of work is appropriate and beneficial for.